iKMC, the babies are put right on the mother's chest, skin to skin on the mother's chest or on the surrogate's chest from labor ward or from the labor ward theater.
Immediate Kangaroo Mother Care is like being more daring and trying to initiate this care as soon as possible after birth.
We are changing the norm actually, making a case that mother has to be with the baby 24/7.
We are able to involve them in the care and make it a family-centered care. So it was easier for us and even more better for these babies. And we have seen the results.
It's an exciting study. It's never been done before. And we know there's very huge mortality in this patient group. Current practice is that the baby is admitted and they're receiving the acute care, and the mothers come in every 2 or 3 hours or so to just hold their babies and then help feed them.
70 to 80% need only assisted feeding and prevention from hypothermia. And for this purpose, they are admitted and separated from their mothers. The mothers are only a visitor.
There are a lot of advantages for KMC, because the baby feels comfortable and secure, and it also promotes bonding.
The idea about iKMC is it possible to provide these two cares? Firstly, give them the medical care which they need, and secondly, in addition to that, can we also give them Kangaroo Mother Care, which has also benefits.
When you have such a high reduction in the mortality, that means if I provide this intervention to babies between 1 to 1.8 kg, we are saving 150,000 babies globally every year. So if I provide immediate Kangaroo Mother Care to 27 babies, then I would be saving 1 life.
The evidence speaks for itself. The iKMC has shown clear benefits in terms of survival, in terms of infections for the newborn, and we now know that all levels of interventions can be performed with the babies right there on the mother's chest.
In the past, mothers have to go and stay outside our ward. But because of the MNICU, the mothers now stay with their babies, and they can care for their babies, and they are satisfied.
If your baby is inside the incubator, it's only nurse and the doctor that can know much about them. But if they are with you, we know everything about them. You can play with them. You will know what is happening.
I felt it was better for the child to be with me, the mother, rather than alone without adequate care and warmth. In my view, Kangaroo care should start immediately after delivery of a baby. It helps the baby survive.
The ratio of nurses to the babies is also quite large. So in that case, mothers being there and taking care of their babies is an advantage for both the mothers and the health workers.
When the baby is in the NICU without mother, 2 nurses or 3 nurses tackles 20 or 30 babies. So chance of cross infection are more. Here, 1 mother, 1 baby.
The mother is not a mere visitor. She is the care provider. So she is changing the diaper and giving the feeds So the rates of sepsis are less.
There was 18% reduction in the clinical sepsis or infection rates.
It also avoids hypothermia that comes when the baby maybe is in cot, because the mother's warmth is the very vital warmth.
Even the mothers were able to signal to us if there is any problem. So babies are not left alone when we are caring for them. So it was easy for us to know when there is problem and then to be able to intervene promptly.
If the baby is going into apneic attack, the mom can easily check the baby. If the baby is not breathing properly, the mom can easily check the baby, and you can easily feed the baby like frequently.
It also increases the rate of breastfeeding, as was shown in this study. So if babies can breastfeed, we know what benefits can have from that.
When they feed the babies, sometimes they vomit, and when they are on iKMC, the mothers, they identify that quickly. While the baby on the cot, they can do that and nobody can notice, and the baby can die.
The postnatal care is to be provided inside. So our obstetricians, they have to come inside the newborn units, and your neonatal nurses who used to provide care to the babies only, now they will be providing care to the postnatal mothers also.
At first, when I was told about iKMC, I thought it's not possible. By then I felt like most of the babies, they cannot be stable enough to be put skin-to-skin contact with their mothers.
We were initially skeptical about carrying babies on the chest, we were not used to it, and very small babies for that matter.
We didn't have the wherewithal, we didn't have the skill, we didn't know how we are going to put it in place. But fortunately for us, lo and behold, we had good results. So it was easy for us to accept it.
My opinion has changed. Because of the experience, I feel they can get every care and nothing is compromising that.
At first, I thought the nurses were joking, but now I see that it was helpful. My baby was born very early. Kangaroo Care helped it to survive.
I was like, how come? She's not an animal, how can she put? But when I saw some people doing it, I was glad. It's like creating a bond between mother and their baby. I will encourage all men outside there that they should encourage this development by putting their baby on their chest, because the sweetest sound a baby can hear is the heartbeat of the father.
It's going to have a huge impact in terms of how we begin to start to look at both the mother and the baby again as one unit of care.
I think that is enough evidence for any government, particularly a government who wants to attain the neonatal goal for the sustainable development goal, which is to reduce newborn death. So I guess any government will want to see that this is a cost-effective intervention.
The mothers also have trust because they feel iKMC has saved their babies. So I feel so great, especially when I'm looking at the outcomes. I feel very happy.